blepharitis is a common reason for getting dry eye disease, and it involves inflammation of the glands of the lids. There are about 30 meibomian glands in the lower lid and the upper lid, and they're really an extension of the sebaceous glands of the skin. So disease of the meibomian glands in the lid that result in blepharitis also can accompany a disease known as rosacea, which is where you get flushing of your cheeks and redness of the cheeks. And so the two diseases can coexist. So it's important to rule out rosacea as a cause for blepharitis. The meibomian glands are very important for releasing an oily substance, and the oily substance is a little bit like coconut oil. So at room temperature it's solid, but if you warm it just slightly, it has a low melting point and it becomes oily. And that oily layer is very important to the tear film. So it prevents the watery layer of your tear film from evaporating. So if your meibomian glands are diseased, the oils aren't secreted and your tears evaporate, and this results in a dry eye, or as we call evaporative dry eye. The rationale for treatment in blepharitis is not to treat the symptoms only. So although we give you dry eye drops, so lubricant drops of some form, that isn't curing the disease. So we have to consider treatments that improve the meibomian glands, and treatments involve initially warm compresses. And although historically we've used warm wet flannels, we now have access to the bead-filled bags which you can buy over the counter, and they're often put in the microwave for a period of time to warm, and then you put them on the eyes with the lids closed until the warmth disappears. And what the warmth does is it starts to melt those thickened secretions and opens the blockages that you get in the meibomian glands, and that as a secondary effect then reduces the inflammation you get, reduces the toxins that build up that can then irritate the tear film. So it prevents all of that. As well as the warm compresses, we also recommend a short course of anti-inflammatory antibiotic treatment. It's used in a low dose, so it doesn't have the full action of an antibiotic, but it has an anti-inflammatory dose, and that reduces the redness and the inflammation and the swelling of the glands. If the glands still aren't functioning fully, we will then consider treatments of some form of mechanical compression. So the commonest ones are the Blepharitis treatments or the LipiFlow treatments, for example. We have to make sure that the inflammation in the eye settled before we consider those treatments. There is also a role for cyclosporin or anti-inflammatory drops to the eye in severer forms of blepharitis. Blepharitis on the whole is not just symptomatically disabling, but can also impact the vision on as a result of the cornea becoming abnormal, and so you can get dryness of the cornea, you can get blood vessels coming across, you can get thinning of the cornea. So it's really important to consider it as a significant disease that can have significant visual disabilities if it's not treated early on.